While the rapid rise of confirmed COVID-19 infections in the U.S. and Europe have drawn global attention, there's trouble brewing elsewhere. Vulnerable developing nations in Africa, Asia, and Latin America, despite relatively less infections so far, may be walking on thin ice with the virus. Are these countries in danger of outbreak on a far larger scale? What are governments and the international community doing to help prevent that from happening? And how are political, diplomatic, and military factors weighing in? To talk about these and more, I'm pleased to be joined by satellite from Tehran by Professor Fouad Azadi from the University of Tehran, from Sao Paulo, Jose Ricardo Jr., the CEO of Lide China, and Dr. Alan Whiteside, CGTN Chair in Global Health Policy, will join us via Skype in the first half of the show, and Dr. Abdinazir Abubakar, the Manager of Infectious Hazards Management Unit of the WHO, in the second half. That's our topic. This is Dialogue. I'm Julia. So let me start with you, Alan. The African continent hasn't been affected that much by COVID-19 as countries in the Northern Hemisphere. So is this a good sign?
Well, we really don't know. You see, what we are counting is reported cases, and I assume that people don't report unless they test. And we know that the health services of so many African countries are so poor that they may not be testing. There may well be cases there. I suspect that what we have is a little bit of time, but we absolutely have to get our acts together as soon as possible.
And other theories, some of the African countries are in southern hemisphere, the weather is warmer there, so probably there will be another onslaught from the virus in the latter half of this year.
Yes, and we would have a very good indication as to how important temperature is if the epidemic moves to the southern hemisphere, but also how it affects the countries of the tropics, the Congos, the Philippines, and so on and so forth. I mean, if they don't have an epidemic, then clearly the ambient temperature does matter, but we don't know yet.
I want to go to another country, probably another continent in the southern hemisphere, that's South America. So Ricardo, it seems that the South American national governments have different response to COVID-19. President Jair Bolsonaro has been downplaying this, saying it's just comparable to a sniffle. So how do Brazilian people think of this?
Well, Brazil is a 220 million people country. So there is a huge debate, a hot debate in Brazil between the ones that supports the decision of the President Jair Bolsonaro to get back to work, while the health specialists, most of the health specialists and the state governors are stressing people to stay at home. So there is a situation in which most of the Brazilians are staying at home. There are several propagandas, several medias informing people to stay at home because of the spread of coronavirus, the COVID-19. So far, we have reported in Brazil 4,600 cases and 160 deaths. But the trend is that we may have a peak within 15 days in Brazil. But the situation now is that most of the business are closed and only essential business are operating, such as supermarkets, bakeries, and hospitals. The leading hospitals in Brazil are even already providing some medicine, hydroxychloroquine, in the patients, because the ICUs are starting to get full.
And Alan earlier mentioned that testing is important because without that, we don't know how widespread infection is. How widespread is testing going on in Brazil?
Well, Brazil is trying to import kit tests, especially from China. because the demand is increasing, and I'm not only telling from the federal government perspective, but also from the state level. The health secretaries and health departments of state level are also importing several kit tests in order to make the hospitals in Brazil to attend the demand. And besides this, there are several hospitals that are fixing the rooms of the hospitals into ICUs in order to receive the demand of the people that will have this COVID-19. But it's important also to analyze the situation under the logistics perspective in Brazil. Because talking about logistics, 60% of the goods in Brazil are transported throughout railways and not ports, airports, and railways. So it means that even the truck drivers, if the lockdown is completely and not a partial lockdown, as President Bolsonaro is emphasizing, the logistics may be affected. For example, the truck drivers, they are facing problems to find petrol stations in the highways and even restaurants to eat. So local communities are providing food for the truck drivers along the highway, in the shoulder of the highway, in order to assist these truck drivers to deliver the goods for all the Brazilian people.
I'd like to turn to Iran. Iran, of course, is the second country after China has seen an outbreak of COVID-19. And to make matters worse, your country is being through extreme sanctions. How are Iranians hanging on there?
With difficulty. You know, sanctions are quite extensive. Technically, medical supplies, medical equipment, medicine is not sanctioned, but in reality they are, because if Iran wants to get this type of medical equipment or medicine, Iran needs to pay the companies that are making these things. And because of banking sanctions, Iran is not able to pay the companies that trade in these types of goods. And the end result is that although technically medicine and medical equipment is not sanctioned, in practice they are. And the Trump administration is not helping at all. In the last few weeks, since we had the coronavirus, we have had new rounds of sanctions. OFAC, the department within the US Treasury Department, is not cooperating with companies that want to trade with Iran. They're not answering emails, they're not answering letters. They're quite destructive. And as you know, these sanctions are illegal internationally. These are passed by the US Congress. They are not mandated by the United Nations. In fact, based on UN Resolution 2231, countries and companies are encouraged to trade with Iran. Article 32 of the UN resolution actually says that no country should interfere in Iran's external trade links. And in reality, what the US is doing is punishing countries that want to follow that UN resolution. So country is facing a lot of difficulties. That's the bad news. The good news is that in the last 40 years, since the 1979 revolution, Iran has done a lot to improve the health infrastructure of the country. So the median age in Iran was 53 in 1979, and it's 73 now. We have an increase of 20% in average age, life expectancy in the last 40 years. So that means that the medical infrastructure is fine. Iran is not running out of hospital beds. In fact, there are some extra beds that are not used, and there are some laws that help with a case like coronavirus. For example, there is sick leave by law. Either your employer would pay if you don't come to work if you're sick, or the government would pay for you not to come to work. And Iran is also helping the Afghan refugees that are here. They're not Iranian citizens, but they are also getting the treatment. And today the government announced that if someone doesn't have health insurance, the COVID virus treatment would be free for them.
So there are good news and bad news in Iran.
So
we'll
the
come
government
back
is
later
trying its best
to Iran. You mentioned Africa. Alan, of course, it's a relatively young continent. The sub-Saharan Africa is home to over 60% of the total number of people living with HIV. That makes it more complicated to deal with a new epidemic like COVID-19. How will Africans be affected? What are the special challenges there?
Well, you rightly mentioned HIV. The answer with that is if we have people on the treatment for HIV, for AIDS and for HIV, using what we call antiretroviral therapies, then they don't seem to be at any greater risk for COVID because their immune systems are boosted. But many people are not on treatment, and for them this is a major threat, as it would be for anyone else, but more of a threat for them perhaps because their immune systems are compromised. A little additional wrinkle there is that so much of the support for HIV treatment comes from the international community, and in particular the United States. So we've got with COVID yet another health issue that is battling HIV and AIDS for global attention. How it will end, I do not know.
Do they have contingency plans if things get worse?
I very much suspect that the people working on HIV and AIDS do not have contingency plans because this has come at us so incredibly quickly. I do hope, though, that the governments have contingency plans and also that the donors who are providing the bulk of the resources for treatment have contingency plans. But I honestly don't know. I do know that I have been very impressed by the South African president, Cyril Ramaphosa, and his statement on the epidemic. I also feel very concerned, and this is maybe something you'd like to pick up, for the many people who are living in slums, in the favelas, in the slums outside African cities. How do we socially distance? How do we provide food, clean water? How do we survive if we can't get to work?
So who will take charge of those places? As you said, I understand there is major concern from the Kenyan government and the UN because the country's 2 refugee camps could be the hardest hit, and the conditions there are not perfectly designed to cope with an epidemic like COVID-19.
Funnily enough, I think that the refugee camps might be a little bit better off, particularly if they're well established, because there is a process for getting food and medicine in. Your real problem comes with the challenge of COVID, which is you have to test, track, and quarantine people. And that's quite difficult to do in a place where you have a lot of people living cheek by jowl. So that will be the challenge for the refugee camps as opposed to getting in food and medicine, because that's a well-oiled process thanks to organizations like the United Nations High Commission for Refugees.
So God forbid, if COVID-19 begin to spread in refugee camps, there is no social distancing, access to clean water and health care, what will happen?
Well, there is some access to healthcare and clean water because the people who set up the refugee camps tried to put that into place. The answer is like any respiratory tract infection that is spread by droplets. I think we'd see a lot more cases, and I think we'd see a lot more mortality. I think the case fatality rate, which at the moment is between 1% and 4%, would go up considerably. I don't believe we'd be able to put masses of people on ventilators because they're simply not available.
So the world will probably have to face the picture of tens of thousands and even hundreds of thousands of people dying in those places?
And in the slums of South America and in the refugee camps of the Rohingya refugee camps, all the places where you have marginal people, we can expect to see things going really badly for the dispossessed of the earth.
And also, Alan, there's the economic aspect of this. I understand that there's the informal economies running in Africa. People probably go outside to do business and make a living in some resort to gig economy. How will lockdown
Yes.
affect their lives?
Oh, God. Well, it's not just in these countries. Again, we talk about marginal and dispossessed people. These are people who are really have difficulty making a living. Now, what we've seen across Europe, in the United Kingdom, and in other countries is people making a plan to ensure that people who are losing their jobs, who are out of their jobs for a while, will have at least some sort of income. I think in some countries in Africa, they will be able to make a plan, as we say, for people to have access to basic needs, to have food, water, basic medical care. But in so much of Africa, this is just going to be an impossibility for so many people. And as you say correctly, there are people on the margins who are really, really going to battle.
And
Refugees, I don't think so as much as the poor in Kenya or Brazil.
And also, there's more worrying signs that on Sunday, the Guardian reports that Johannesburg soldiers there fired rubber bullets to disperse a crowd gathered outside a grocery store. So, what is the chances of social unrest, and what are the government's capabilities of maintaining order in those places if run out of control?
You've put your finger on the one thing which I think is absolutely critical, and that is how are people going to react to this? Are we going to see social unrest? Of course, I believe the governments can keep control, but it is going to be at a cost. Now, we're in just a few days into the lockdown, so as it goes on, as tempers fray, we could see an escalation, and we could see that the military and the police being brought in to take control of the streets. South Africa has done something which I don't think any other country's done, and that's ban. You can go and buy food everywhere in the world if you have to. In South Africa, you can't buy alcohol or cigarettes. And that's going to be a major social experiment, which we will be interested to see how that works.
All right. Thank you very much, Alan. And Ricardo, the South American picture is probably different. Not only Brazil, the presidents of Mexico, Nicaragua have all downplayed the seriousness of the coronavirus. First of all, why did they choose to send messages like this, and do the people there buy the messages?
Well, again, it's a huge discussion in Brazil if we should have the social distancing or we should have the completely lockdown. If you compare the economy from Brazil with China, the small medium enterprises in Brazil, they are responsible for 30 million of the total GDP, while China, the small medium enterprises are responsible for 60% and Brazil 30%. Besides this, there is also a challenge in relation to the slums, to the favelas, because in the favelas, not all the people have access to water, to food, and they have also the support of the government. Now the government decided to inject 160 billion US dollar in the economy, and for the low income families, they will receive what we call in Portuguese the coronavirus voucher, and it's $120 for each low income family. Again, the government from Brazil, in the federal perspective, the president is really concerned, especially about the small medium enterprises and about these poor people that are working informally to save these people's life and also to guarantee the jobs. We may have to remember what was discussed in the G20 last week. One of the pillars is to save lives, for sure, but another pillar is to keep people with their jobs. So probably we're going to see in Brazil within the next 15 days a lot of layoffs because of the factories that are being closed.
But the problem is, do they worry more about the health issue, or do they worry more about the economy as much? Because we have heard reports that when the government failed to deliver strong messages, there were armed gangs and civil institutions imposing their own improvised lockdowns in different neighborhoods in Brazil. How much does that factor in to this?
Well, the President Bolsonaro is very concerned about people losing jobs. That's the reason why he's trying to convince people to have this partial lockdown. But at the same time, his team, especially the Minister of Economy and the Minister of Health, are also doing a very good job stressing and giving the message to the Brazilian people that people should stay at home, life first, and then we will discuss about economy. So the Ministry of Economy from Brazil is sending the message to the people that people should be safe at their homes, and they are working in order to provide some economic policies to recover the economy. Again, this is a particular behavior of the president, but all his team is emphasizing the importance of people to stay at home. And that's the majority of the population that are willing to firstly save people's lives and then recover the economy. This is not for sure the opinion of several entrepreneurs. That some entrepreneurs, they are thinking that we should at the same time keep the old people at home and start and regain and going back to the economy again.
Yeah.
But this is something that people are completely divided here in Brazil. Only for your reference, 50% of the people that contracted the COVID-19 are under 60 years old. So this is not true that only people over 60 years old may have the COVID-19.
All right. And Fawad, in the Middle East, different countries probably have their different challenges, but for Syria, that country, probably the challenge is more complicated. It reported its first death from coronavirus Sunday, 10 confirmed cases. That's still a very small number, but remember that country has been ravaged by a war and is still undergoing political infighting. So how will Syrian government and civil societies cope with an onslaught of a virus like COVID-19?
You know, I think whether it's in Syria or Afghanistan, Yemen especially, you have a situation that war has devastated the country. And I think it's a good time to stop all wars, stop all sanctions, stop using instruments that end up killing people. And if these countries, the countries that we named, are not treated in a more human way, you will have hundreds of thousands of people passing away. The Palestinians in Gaza are under siege, and wherever you have a concentration of people with limited resources, with sanctions, with trade embargoes, you're going to have many people die. So it's time to stop all these policies that result in wars and sanctions.
Do the people in that part of the world feel the urgency of the public health challenge, so they are willing to lay down arms and avoid conflict at this particular time?
That's right. That's right. And the people that will die because of countries like United States, like the Israelis, like the Saudi government, that are bombing people, sanctioning people, creating concentration camps. The people who will die will be the responsibility of the countries that are following those policies. So they need to stop, especially when you have a pandemic like this.
And Mr. Abdinazir Abubakar, you are an infectious disease specialist, and you know how infectious diseases spread, and you've covered the spread of the Ebola and cholera in Africa. What do you think the lessons we can draw from our experiences dealing with those outbreaks and maybe be helpful in coping with this new one?
Well, thank you very much. I think it's so much lesson that we can learn in the previous outbreaks, Ebola, Zika, and also H1N1. And the most important thing is that, you know, of course, what's important is, you know, the capacity that the countries have built for many years when it comes to the preparedness and the prevention capacity. Now it's actually paving the way in order to enhance the prevention and control of this coronavirus. And I think the reality that we have here is, despite all our resources and investment that we made for many years, even after Ebola, for our health system, we still felt that countries are not prepared enough to deal this kind of outbreak, which has a different magnitude as compared to the previous one. I think, as you have seen, that we have only 3 months since this outbreak is started in China, and that now have spread globally, literally all countries in the world, which over 700 or 750,000, 40,000 or 35,000 or 40,000 deaths that you have. And that clearly shows that despite all the experience and lessons that we learned, that the world is not prepared enough to deal with this kind of
and maybe
outbreaks.
that is the key. You mentioned capacities. Different countries, especially those developing countries, have different capacities, and it is not easy to beef up their capacities in a short time span. How can they cope if really the virus gets to their shores?
Well, the way they can beef actually is, yes, I know that some countries, even the developed countries, if you see now, they are really struggling to control the outbreaks despite all the investment and resource that they put. But the most important thing is countries need to prioritize what intervention is actually it's more effective as compared to the others.
What do you think it is
the
most effective preventive measure? Is it lockdown?
Well, lockdown is not a prevention. I think the most prevention and response intervention is in which WHO has been promoting actually is we really need to find the cases. If we find the cases, we need to test those cases, and we need to isolate those cases that we find, and we need to manage those cases that we identified.
But they don't have testing kits, and they don't have medical staff to carry out those tests in the developing countries.
Well, then at least we have WHO, we provided guidance. If you don't have a test, there is also another mechanism that you can identify the cases, which is a clinical diagnosis. Because if you have a clinical diagnosis, then this is also alternative option that you can just minimize the impact it will have a health system. And I think we have some of those complex emergency countries, they have early warning surveillance, which can detect the cases early. Look how the cases are detected in Syria. Look how cases are detected in Libya. Look how the cases are detected in Somalia. I think there are systems in place, but what we need is we really need to do more resources and more investment.
Is it realistic now for those countries to expect help and assistance from those developed countries who are still struggling with this, like Europe and America?
Of course, yes. I think we really need to lend hand to those countries. I cannot imagine that, if the outbreak spreads in Syria or maybe Yemen or maybe countries with complex emergency, what impact it will have. The people who are already suffering, the IDPs, the refugees, the displaced people, the returnees. This is one of the things where WHO has been warning for quite some time, that we really need to pay attention for those people with complex emergencies. And the developed countries actually need to look back on those people. I understand that the developed countries are already suffering themselves, but again, we should not forget the countries which already have acute emergency and weak health system.
Otherwise, the impact will blow back to those rich countries finally.
Indeed. I think the developed countries will pay the price at the end if they don't help and support those countries who are really have a weak health system and complex emergency.
Okay, thank you very much, Abdinazir. Thank you, Fawad, and thank you, Ricardo, for your insights. You've been watching Dialogue here on CGTN. I'm Joe in Beijing. Thank you so much for watching. Goodbye.